Jack was born prematurely at 36 weeks and 5 days gestation. He had difficulty latching during breastfeeding. When Jack was 24 hours old, we noticed that he was difficult to wake up for feedings, and people also started to mention that he looked yellow. The doctor indicated that Jack had jaundice and would be admitted to the pediatric unit for phototherapy. Jaundice is caused by an elevated level of bilirubin. Bilirubin is a yellow-brown or orange pigment that occurs when red blood cells are broken down. Elevated levels of bilirubin can be detected through a blood test and indicate an immature liver, poor liver functioning, excessive red blood cell destruction, or a block in the bilirubin pathway. Physiological jaundice is due to an immature liver. To understand bilirubin, we have to understand how it's broken down in the body. Red blood cells are broken down in the spleen and are broken down into heme. Heme reacts with the heme oxygenase in the spleen to create biliverdin. Biliverdin reacts with the enzyme biliverdin reductase to create bilirubin. In this state, bilirubin is unconjugated and is not water soluble. It needs to bind to albumin, a transport protein, to be able to be transferred via the blood to the liver. In the liver, the bilirubin reacts with glucuronic acid to create a conjugated form of bilirubin that is water soluble. The water soluble form of bilirubin goes through the bile ducts into the duodenum of the small intestine, through the large intestine into the colon, where it reacts with microorganisms to create urobilinogen that is then excreted from the body in the feces. Bilirubin metabolism is shown on this slide and shows how the molecule changes with each reaction that was previously discussed. Contributing factors for bilirubinemia, which is an elevated level of bilirubin in the blood, include premature birth, significant bruising during birth, mother and baby having incompatible blood types, and infants who have difficulty nursing. This graph shows how the gestational age affects increases the chance that the baby will have jaundice. The treatment options for jaundice include delayed cord clamping, increased feedings, and phototherapy. The two options for phototherapy are billy beds and billy blankets. Phototherapy works by using photons of light energy to break the bilirubin into isomers that are easily excreted by the liver and kidneys. So, what happened with Jack, our Billy baby? He was admitted to Pete's for one night where he did phototherapy in a billy bed. Then he was discharged home with a billy blanket where he followed up for 4 days using his billy blanket 24 hours a day. When Jack was 7 days old, he was discharged from all therapies because his bilirubin had finally reached a healthy level. If you look closely in this picture, you can still see that he has yellowing of his skin in his cheek and neck. Babies with jaundice typically will show the yellowing in their eyes, cheek, neck, and trunk. Jack, after 7 days, Jack was a healthy baby boy.